Hello, everyone. Welcome to our Family Matters series. We're so happy to have you join us for this episode. Our topic today is a very relevant one for families and caregivers, as we know that fall prevention is extremely important for older adults. So today, we're going to discuss techniques to manage physical and cognitive challenges to decrease risk of falls. And for this episode, we are joined by our expert, Dr. Kelly Laffin, a physical therapist who specializes in neurological rehabilitation. Dr. Laffin, thank you so much for being here today. Would you mind taking a moment to just introduce yourself and tell our families a little bit about yourself and your background as a PT?
Sure. Thanks so much for having me. I've been a PT for 17 years, helping patients with neurological disorders and diseases. I began as a therapist in an inpatient rehab facility, and then I transitioned to working actually with a medical device company as like a clinical specialist. And then I actually moved to being a director of a new outpatient neurological clinic in the Frederick, Maryland area. And now I serve as the therapy manager back at an inpatient rehab facility. So many things throughout my career, but always geared towards older adults and or neurological injuries and disorders.
Great, thank you. Well, we're so happy to have you here to share your
Thank
expertise
you.
with us. So our topic today relates to balance and aging. Could you start off by just briefly explaining how balance works? I mean, is it your brain that controls balance? Is it your muscles or both?
Um, Great question. It's really both. First, your brain needs to know where you are in space, and then your brain will communicate that to your muscles. So your brain gets a lot of information from various systems to know kind of where you are in the world. So our vision probably is one of the most, easiest to kind of understand. That tells your brain obviously a lot about how you're positioned in space, what's up, what's down, what's vertical, etc. Then there's a system called your proprioception, proprioceptive system that tells us how our joints are positioned. So, for example, are our ankles flexed like we're walking up an incline, or are they pointed like we're walking down a decline? Maybe is one knee bent and one knee straight, perhaps like we're on an uneven surface. And then the third primary system that gives our brain information is called the vestibular system. That's the system located in our inner ear. And that provides a lot of information on head position, head movement, head acceleration. So we get all this information to know where we are in space. And then our brain has to communicate that through nerves, through the spinal cord and the nerves to our muscles, and tell them how to activate in order to move the body parts and adjust positioning in anticipation of some sort of planned movement you have, or to react, to recover your stability after maybe an unexpected disruption, like if you were to lose your balance.
Okay, wow, that's interesting. So
That
balance is definitely, it involves a lot of systems
very
within our body then.
multifactorial. Yes. Yeah.
Okay, that's super helpful. And then could you talk to us a little bit about how balance is affected by normal aging? Is balance affected by normal aging?
It is. It is, unfortunately. Yeah. Normal aging can affect multiple aspects of all of those different areas that I just spoke about that are important for maintaining balance. As you can probably imagine, our vision declines often with age, so that's going to affect our visual perception. Um, that proprioceptive system that I mentioned, that can decline with age. So both of those are going to really impact kind of how our body is able to sense its position in space. And then our vestibular system also naturally declines with age. And so you may notice actually when that happens that older adults may become like over reliant on vision because they aren't able to clue in to the information from their vestibular system. Um, and then we also have musculoskeletal changes. So we have changes with our muscles. They weaken, they become, our joints might become less flexible. We might lose range of motion. We might have slowed reflexes. So all of that is going to kind of negatively impact how we can keep our balance or recover when we have a loss of balance.
Oh, okay, that makes sense. So we know that people can have age-related changes in cognition, like in memory and processing speed. can changes in cognition make balance worse? So if someone has, say, a diagnosis of mild cognitive impairment or dementia, does that affect balance?
Yeah, it that can as well. So as you mentioned, cognitive functions can play a crucial role in kind of memory, processing some of that sensory information that we're getting from the world. And so that can lead to difficulty in spatial orientation. It's also cognition's involved in like planning and performing complex tasks, like complex movement tasks, like walking, changing direction, the coordination of movements. And then thirdly, balance requires concentration, especially if you're in a challenging environment. So oftentimes you may find that if someone has a cognitive decline, they just can't do multiple things at once. And so they might have to spend extra focus on the cognitive piece of it. And then that may make the motor piece or the walking piece or balance piece, that might make that suffer as a result. So you might find that they have a difficult time doing like dual tasks, like walking and talking on the phone or walking through the grocery store while they're scanning the shelves and they're trying to remember their grocery list. They might have difficulty washing their dishes and engaging in a conversation or telling a story. So cognition can definitely play a role in balance, and cognitive decline can negatively impact balance.
Okay, okay. So it sounds like you can have an age-related decline in balance, but then if you add impairments in cognition on top of that, again, maybe something like mild cognitive impairment or dementia, your balance could be even further compromised.
Exactly. Yeah.
Okay, okay, that's good to know. Are there other things like medications or even other medical conditions that can make balance worse?
There are quite a few medications that can cause side effects like dizziness or lightheadedness or drowsiness or even like cognitive fogginess, and all of those things could impact balance. Um, there are quite a few medical conditions as well. Any sort of disorder or disease that affects the inner ear or affects the vestibular system can cause dizziness, can impact the role of the vestibular system in maintaining balance. Any sort of like a joint surgery or injury can negatively impact the muscle strength, the range of motion. And then, there are injuries, neurological injuries like that affect the brain or the spinal cord. I'm thinking like somebody who has had a stroke or multiple sclerosis or Parkinson's disease or concussions that can impact how your brain receives the information from the environment and then is able to send that information back down to the muscles. And then even like some chronic diseases like heart disease, diabetes, kidney disease, they can affect different systems that play a role in balance. So there's a lot of other factors, medications, medical conditions that can also play a role in balance or affect your balance.
Okay, that's great for our families to know.
Mhm.
Um, so to connect the dots between balance and falls, we know that decreased balance can increase risk of falling, right? So as a caregiver, how can I tell if my loved one's balance is declining? I mean, I know sometimes it's obvious, but are there signs that I could look for proactively before it gets to the point where the problem with balance results in a fall?
Yeah, probably the most obvious is just like unsteadiness on their feet, somebody who's maybe staggering, who, needs a few extra steps to kind of recover some slight disturbances. But as I mentioned earlier, like if you notice that your family member is looking down at the ground a lot, they might be somebody that's becoming very reliant on their vision to tell them where they are in space instead of being able to use some of those other systems. Or somebody might have a much harder time at night, you might notice. Same thing, because they're getting less visual information.
Okay.
Or if they're complaining, sometimes people that are having balance difficulties don't necessarily know how to describe that. They might say that they're feeling lightheaded or they're feeling dizzy, or sometimes they're feeling giddy. That's a word that sometimes is used. And then, lastly, probably like if you notice that they're reaching for furniture or they're reaching for walls, things to hold on to help steady them while they're moving, that could be a sign as well.
Okay, that's really interesting, especially the what you said about people looking down because they're relying so much more on their vision when other systems maybe aren't working as
Right.
well to help with
Yeah.
balance. Yeah.
Yeah.
Okay.
And that becomes hard functionally, right? Because, if you're out in the environment and you're not able to scan the world real well because you have to be so hyper fixated on the ground or on your feet, that can pose whole nother slew of safety concerns.
Right,
Yeah.
right. I would imagine like crossing a road, it wouldn't be a great idea
Right.
to be looking down the whole time. Okay. And then if someone has one fall, Dr. Laffin, are they more likely to have another fall? I mean,
They are, yeah. Research has suggested that there is an increased risk of falling once you have your first fall.
okay.
Um, Probably some reasons for that we could imagine is that if there's an underlying medical diagnosis or medication, like we talked about, if that's kind of an underlying reason for the fall, that obviously needs to be addressed, or there's going to be a risk of continued falls. Um, then a fall can actually lead to further injury. It can lead to, weakness. It can lead to reduced physical activity, which might contribute to weakness or stiffness, and that can place someone at further risk of falls. And then a lot of times families might this might be obvious to them, but falls can lead to then just like a fear of falling. And actually that fear of falling can lead to decreased physical activity. And that can actually lead in of itself to increased risk for falls.
That makes sense because people are afraid to get up and do things because they've had a
Exactly.
fall and they don't want to fall again.
Right.
Okay. Yeah.
And they
So
might
it's kind
start
of a vicious cycle.
changing. Yeah, and they might start changing how they're moving, taking short little steps, which then might increase their risk of tripping. So yeah, they might make adjustments because of that fear that aren't advantageous.
Okay. So caregivers should take a fall seriously. I mean, if someone has one fall, and of course, I mean, I'm sure anybody could fall. You could fall, slip on the ice and fall, even if you don't have any other medical conditions or compromised balance. But in an older adult, one fall should be taken seriously.
Yeah,
Is that right?
definitely.
Okay.
Yes.
Okay. And Dr. Laffin, it sounds like addressing balance deficits proactively is important. So, to that end, are there things that can be done to prevent balance from decreasing before it starts to decline in the first place and then, result in a fall?
Yeah, prevention is always the best course of action, I think, for a lot of things. And just the same with balance. The best approach really is to stay active as much as possible. Um, exercising our muscles to help maintain strength, to prevent loss of range of motion, to prevent stiffness. That's probably the best proactive approach somebody can do is just maintaining activity as much as they can. And it doesn't need to be, intense workouts at the gym. It could just be a walking program, um, a swimming program if they want to help relieve stress on the joints, but just staying as active as they can. And then it might be worth, having conversations with the doctor about some of the medication side effects and some of the disease management pieces and making sure that there's a comprehensive overview of, the medication piece so that there's not contributing factors from that.
That's great information. And that makes me wonder also if an older adult is prescribed a new medication, perhaps side effects of decreased balance or increased risk of falling are
Mhm.
important things to look out for.
Yeah, I've definitely seen
Okay.
a lot of patients that have come to physical therapy for balance retraining, complaining of unsteadiness, dizziness, and you- when we probed further, we were able to discover that perhaps it was a medication related dizziness. And we would encourage them to talk to their doctor. And oftentimes the doctor could trial different things. And that would actually in of itself help greatly reduce some of those symptoms that they were feeling.
Okay,
It
that's
just
great.
depends.
That's great to know. Yeah, that's great to know. Um, Now, what if somebody is at the point where they're already noticing changes in balance, or maybe they've had a fall, or maybe they've had near misses? What could be done at that point to improve their balance and then, and or prevent further decline?
Yeah, I mean, I might be biased, but I would recommend physical therapy to really aim at addressing some of those balance deficits or some of the contributing factors to the balance. That it might be strength, that might be range of motion, that might be improving the vestibular system, that inner ear system. So I think physical therapy can be a huge benefit for individuals after they've had a fall or as they're noticing their balance is starting to decline. Um, if they've had a fall and they're trying to make sure that they're maximizing safety as much as possible, the physical therapist may also recommend certain adaptive devices, certain things to walk with to help with their balance, like a cane or a walker. They're going to ensure that's set to the appropriate height. They might make recommendations for the bathroom, like adding handrails, certain grab bars in the bathroom and the shower. Um, and then there's a lot of other things that could be kind of impacted in the environment to help maximize safety. We want to ensure that lighting is good, especially on the stairs or and especially at night. So oftentimes we'll recommend that people leave a light on at night for bathroom trips or use motion activated lights in the hallways or stairs. Um, we want to try to reduce tripping hazards, remove throw rugs, ensure extension cords are kind of out of the walking path. Make sure that we're wearing good supportive non-slip shoes. So no slip-ons, no floppy slippers, no flip-flops. And then even just kind of assessing where things are located, in the kitchen, in the bathroom, making sure things are in easy reach. Squatting down is going to be a bigger challenge on our balance systems, as well as like reaching up high. We don't want to, step stools is a big
Climbing a
risk
ladder, yeah.
factor. Yeah, ladder. So these are a lot of the recommendations that could be made in the environment, and the physical therapist can help guide an individual on what's best for them.
Okay, that's great. That's really great information. Um, I know you said that cognitive deficits can also increase balance challenges and fall risk. So, obviously working to improve your cognition through targeted cognitive exercises would be helpful. Are there any other things, Dr. Lappin? You covered a lot of the environmental changes, but are there any other things that could be done to help prevent falls?
Yeah, so I mean, to address specifically some of the cognitive changes, a lot of clients will also receive benefit from occupational therapy or speech therapy, which may particularly target some of those cognitive changes. I'm sure the BCAT can be a helpful tool for a lot of folks to help with, maximizing cognition. So I think that it is important to address kind of the whole person, the whole brain body together when addressing falls and balance.
That is such an interesting point that it's not just any, one thing could be contributing more than another thing, but balance and fall prevention sounds like a very systemic and environmental situation.
It is, yeah, yes, it can be very complex.
Yeah, that's a really interesting way to look at that. Um, okay, so if somebody, you mentioned physical therapy, if somebody does want to see a physical therapist, are there specific types of physical therapists, or, should families look out for a physical therapist with certain credentials? Um,
Yeah. So there are, there's physical therapists that specialize in lots of different things. We probably most commonly would think of somebody that's helping like an individual, an athlete, or a sports related injury. And so instead, I would recommend finding a physical therapist that specializes in balance or specializes in neurological injuries because it's a really complex neurological uh, contributions to it.
mhm.
Some of you mentioned like credentials, some of the credentials in the physical therapy world, we have board certified neurological clinical specialists, The letters behind the name would be NCS, or board certified geriatric clinical specialist, or GCS. Those are some that have gone, through some extra training, certification, exam to demonstrate proficiency and I would say a higher level of proficiency in helping folks with neurological injuries or the older adult population and what comes with it. Yeah.
Okay, that's great. And then lastly, Dr. Laffin, are there any other resources like websites, for example, that family members could use for more information on balance or fall prevention?
Um, hmm.
And if they answer, if not,
No, I'm
it's
trying to
okay.
think. There's not anything that's coming to mind right away. I think there's a lot of information out there about balance and about falls. And that's why I think sometimes it's nice to work with an individual therapist that is fully assessing the impairments that might be leading to balance, so that we can just make sure we're tailoring some of the recommendations specifically to that individual. Yeah, I don't have anything specific regarding that.
Oh, that makes very good sense. I mean, you mentioned earlier that, it's not necessarily usually one thing that's causing this disturbance in balance. So it seems like it would take a skilled therapist to really dig further. Dr. Laffin, thank you so much for taking the time to be here today and just sharing all of your knowledge on this topic. This was really great information for caregivers that may be worrying about their loved one having changes in balance and being at higher risk for a fall. And of course, thank you everyone for joining us for this episode of Family Matters.